is Scott Fishman. I'm a professor in anesthesiology and pain medicine, and with actually a secondary appointment in psychiatry and behavioral health. I'm actually trained as an internist and a psychiatrist, but I started the pain program here many, many years ago. And in doing so, it became very clear that so much of the chronic illness that we see in medicine is due to lifestyle choices that could have prevented the outcome of the chronic disease. And, you know, in looking at this over many years, even though the Hippocratic Oath you guys are all going to take at some point speaks to your role as being treaters of disease before it happens, preventing disease, and there are a lot of ancient models where, you know, the health providers were judged by how many people didn't get it ill, as opposed to, you know, by, you know, counting the money you make by all the people that do get it. It's still clear that it's part of the scope of practice that you're going to be going into as medical students. Now, I assume you're all medical students. Am I correct about that? Yeah. And are you all? How many first years are there? Oh, great. And how many second? I know the second years are doing some testing today or something like that. Third year? Fourth year? Third year? And no fourth years. Great. Come on in. Welcome. So, I am now the executive director of your School of Medicine's Office of Wellness Education. And I know from many of you that you hear about wellness a lot, but what we do is very different than what you've been hearing about. You guys are hearing from student wellness about taking care of yourselves, which is extremely important. You're going you're going through a stressful process of being students and heading into a stressful process of being clinicians. With that, it's really important that you learn pathways or you adopt pathways that allow you to remain well, which means that you're able to stay happy in life, and that you're able to keep a life in motion, that you're able to manage your fuel, which is your food and your spirit, stay connected with others, have a full life, and help your patients. You know, it's the old, put the oxygen mask on first, before you can help others. But with that, it's also part of your scope of practice to understand and care about preventing the illnesses that your patients potentially may not have to incur. And that's what our office is all about. It's not only about helping you understand that that's your scope of practice and maybe help you with some information around that, but also help our community with that. We don't do it because economically providing wellness services for patients right now is really not economically reimbursable, and therefore it becomes an economic load. Although if you really look at the return on investment, it's probably the smartest thing that we could do globally for our society, because we're drowning economically in the cost of caring for otherwise preventable chronic illnesses. So our job is to help create the information that people out there would need to make informed decisions about lifestyle. And I can tell you the whole wellness arena is just a sea of misinformation. Most of the information is based on people trying to sell something or sell a point of view. So hopefully UC Davis, which now has an Office of Wellness Education right next to our Office of Medical Education, we're really the first medical school in the country to address this at a very high level of a school of medicine. So I think you can be very proud of your school for doing this. Our goal is to at least do what we can to inform people in an agnostic, unbiased way about the issues around being well, until you guys become clinicians and you can do it with your patients. So that brings me to the topic of our talk today. And Dr. Gina Lokna, who's here. Dr. Lokna is trained as a primary care clinician. She's family medicine trained, but she's also trained as a specialist in sports medicine. And you may be wondering why family medicine and sports medicine is somehow on the on the stage for wellness, but really sports medicine is about performance. And honestly, life is about performance. Quality of life is inextricably linked to our ability to do the things, be able to do the things we want to do. And as we see people get older and they have chronic illnesses, what marks it most is their diminished function. And that diminished function then starts to diminish the things they want to do in life, the things that make life worth living. And then we come back around and say, oh my gosh, you don't have function and you don't have quality of life. Let's help you with that. Well beyond the point that we could have really prevented it. So what we're finding in sports medicine, you might think that all they're doing is taking care of world-renowned athletes, which in fact our sports medicine people are doing. But beyond that, sports medicine has really become a medical specialty for all patients because we're all essentially running a marathon. And that's why much of the wellness perspective from major medicine is coming from sports medicine. Not so much, how to win the Boston Marathon, but kind of how to win the life marathon and how to balance, your marathon so that you not only succeed, but the people around you succeed and your world succeeds. So with that, Gina Lokna is really a world expert in all of these things. She has incredible life experience at the front line of clinical medicine, of being a wellness doctor, who's both a longitudinal care provider who's now integrated this idea of something called functional medicine, and I'll let you talk a little bit more about that. But really looking at function as a guide, and kind of going back to the roots of what's important in terms of our diagnostics and our focal point on helping our patients. So with that. The last thing I want to say is we'll have a talk and then hopefully a chance to really discuss this issue around your role, your impending role in doing the same things that Dr. Lokna has done. So without further ado, Gina Lokna.
Thank you. Very gracious. Thank you guys for coming. I think the biggest endorsement around what I'm going to talk about is what I do is really enjoyable. I have a lot of energy around it. I've been doing it for a long time. The versions of what I've done have shifted a little bit, and it's become increasingly more energizing to help people be well. And so the spirit of that is kind of what I want to impart today. There's so much to learn at the beginning of medical school. And I was mentioning to you guys that I'm having longitudinal rotations with students that are coming in second half of first year and then into second year and rotating. And when patients come into the office, whatever it is that we're seeing, we have to have some baseline knowledge to give them appropriate treatment and recommendations and diagnostics. I mean, they're there for a reason. I often walk into a room and it's, hi, how are you doing? I'm fine. And I say, well, nobody really comes here because they're fine. What can I help you with today? There's always a reason that they come in. But it really, I want to encourage you, is your portal in to looking at this whole person sitting in front of you and see how we can move them from the reason that they came in, their chief complaint, if you will, if you want to use the word complaint, but really their presenting thing that comes in to tie into your expertise, which is deserving. But your opportunity then is to gain trust and have a rapport and move toward a little bit of a higher altitude or vision toward where they can be more optimized, where we can really push wellness into a place where they're not seeing you as often, where they feel better, where they're more productive and happier in the world. And what I want to say is that is a little more structured than it might sound. Sometimes we use these words and they don't have good definitions, but I'm going to give you an example in my practice of how I put in some concrete steps that have been pretty well received. My colleagues come to me and they want to know about it. My patients come back and want to have follow-up appointments about it. So that's what I want to share today in the spirit of promoting wellness in terms of looking at people in a much broader way so that we are going way upstream from the thing that actually brought them into your office, whether it's for chronic disease or knee pain, which is what I see a ton of every day. We're looking to see where we can implement change and really empower people to have some knowledge and expertise so that they can take charge and make some of these things happen before they come in to see you. Like Dr. Fishman mentioned, we're bankrupting ourselves trying to chase this wheel of disease and injury and chronic kind of decline in health. And I want to tell you, just as a clinician, patients don't like it either. They don't love being filled up with doctor's appointments. Like, I'm the third appointment they're seeing today because they've got, follow up on all of these chronic issues. It'd be so nice if we could rewind some of that and do some higher leverage change earlier on before it gets to this kind of chronic disease state. Okay, that's kind of my mission. That's the thing that energizes me, that infuses my clinical practice. But I'll give you a couple of thoughts on my journey because I do think it influenced things. So sports medicine for me was a 5th grade decision from a school ski trip up at Boreal. Do you guys know Boreal? I grew up in this area, Placer County. So 5th grade, school ski trip. I fall under the ski lift, of course, where everybody's, making fun of you. Broke my leg, got tobogganed down, and then entered the world of some orthopedic stuff, multiple surgeries, et cetera, for the next few years. And weirdly, I was interested. Like, instead of being, oh God, another doctor, I don't want to go in, I would want to look at the x-rays and I would want to be engaged in what's happening with surgery and seeing all these specialists. And so it kind of whet my appetite. And the interesting thing that you'll find out if you survey sports medicine doctors, almost everyone has a story, something like that. Like, what drew you to this profession? Almost inevitably, there was some kind of a trauma, or they were an athlete and they had their own experience with surgery or rehab or whatever it is. So coming into medical school for me, I knew I wanted to do something sports oriented. And I have to be honest, it's partly because I wasn't really that excited about seeing a lot of sick people. I was athletic. I grew up with a health nut kind of family. So wellness was, before we use that term, kind of baked into what I grew up in. And so, full disclosure, that was the lens through which I saw life. And it really was what I tried to actively seek out. Primary care for me, family medicine, I trained here back in the day, back in the long day, and loved the breadth of practice. And it was also really my first lens in on chronic disease and chronic things that need to get followed up and medication, and deep dives into those areas are important. You have to know how to take care of it. But I don't love to swim there full time. I always want to try to move people toward a direction of improvement. And wellness is, I think, not a perfect term, as we've talked about before, but it's sort of the best one going to give everybody the flavor of what we're hoping for. So primary care, I do my residency, I do a fellowship in primary care sports medicine, and then I'm hired here to work for the next 13 years or so. Team doctor, lots of events, super fun co-practice with sports orthopedists. And we developed over in sports medicine during that time a sports performance lab. So the word performance, and originally it was designed to bring in athletes to test. Have you guys seen those commercials or like the Gatorade lab, right, with the mask and they're running and the VO2 max test? You guys heard the term VO2 max? Lactate threshold testing, we have weight equipment in there, we have body comp machines, we have bike fits. Did you know we live in the capital of, endurance capital of the world for events that they host? Yeah, so there's a big market here. Runners, distance events, triathletes, cyclists, and it's huge. I mean, the weather's great. There are a lot of events that are around here, a lot of great training around here. So over the years, we've had lots of groups come in and get testing. We had at one time a physician from Italy who came over and worked with us. He was big in the cycling realm. And in countries outside of here, athletes are extremely accustomed to doing lots of testing for their training and coaching parameters. In fact, they use data pretty religiously. And his comment sort of in jest to us was, the cyclists that we were seeing here, it just more training is better, more. And he said, everywhere else, people are too lazy to do that. Like, give me the program with the data that's actually going to give me the output that I want. So the sports performance lab was really an area where we got to capture people who weren't coming in necessarily for anything that was illness related. They were strictly coming there to look for performance improvement and coaching. So Adjacent to that then comes the nutritional element, right? If you're training, especially if you're doing endurance events, you need to know how to stay healthy, you need to know how to fuel. So the lens through primary care that I worked on really was applied to athletes or well people for the most part, and learning a lot about exercise science. How do you change VO2 max? What about your muscle composition? Are you more of a climber? Are you a sprinter? Are you a power lifter? What's body comp like? And so that was the kind of the pool that we all swam in. And then, you end up seeing shoulders and knees and covering football games and all the rest. But it was this nice kind of wedding of what the mechanics of a body will do and what injuries like, traumatology would be another word for it, and then the performance of things, which is everything that you would do to fuel, to stay healthy, to remain uninjured, and to go the distance. Okay, so fast forward a few years, I have 2 boys. My baby's 6'7", just for fun. So they're not so little anymore. I have 2 boys. I take a break out. I'm mom for a while. And when I returned to practice part-time, I have a friend and colleague who also trained here in my era, who is doing primary care up in Folsom, private practice. And she said, you know what? I got pretty burned out seeing the same kind of chronic problems and diseases that are coming through. I need a different way through. And for her, she really embraced integrative functional medicine, so-called root cause medicine. And the idea was that unlike one specific diagnosis for a disease, and we're treating it all in isolation, really looking at the body as this big system collective. What's affecting one area is most certainly affecting another. And to further complicate things, those interactions produce their own set of endpoints. And the idea is, where can we go in and start looking at the commonalities where if we made changes here, we'd have a lot of downstream positive results, right? I'm really simplifying a definition of functional and integrative, but functional medicine, the tag is root cause. There's a tremendous amount of testing available for that in conventional medicine is a little bit different in terms of looking at deep dives of data sets, but you can look at deep dives of an astonishing number of things. You want to look at gut microbiome, there's tests for that. You want to look at all manner of vitamin insufficiencies, there's tests for that. You want to do toxin screens, there's tests for that. So a lot of the people that would come to that practice that I worked at for a few years were very interested in a different mindset toward their health. And I do think it starts there. It's pretty difficult to strong arm anybody into wanting something more than they want it. Have you ever noticed that? Like, I can't want it more than you. I can educate, I can give some information, but I can't provide you some of that fire to want to do things differently. So we did have a select population that came there who were actively doing research on how to move the needle toward this more wellness direction. And now have you guys heard of lifestyle medicine before? Lifestyle medicine? Okay. Lifestyle medicine has their 6 pillars of health. Integrative medicine has a lot of emphasis on mind-body connection. Functional medicine with emphasis on root cause. So there are some lines drawn around, we do this and not this, or we do this and not this. I think a nice way to encapsulate that is that everybody's common goal is to look at a person as a whole entity, that we're trying to get a lot more integrated with our approach to seeing what's your mind doing, what's your body doing, what are all of your systems doing, and where can we move the needle. And the truth is, this isn't just in medicine. So here's the other thing that's happened to me on this journey. Eventually, I came back to work at sports medicine here on C Street and was straddling both practices, which was not sustainable. So I no longer work at the integrative primary care practice, but it's really true, you can't unknow what you know. So as I'm back in sports medicine and I'm seeing somebody coming in for a certain condition, I'm starting to ask different questions than I was doing before when I was solely focused on one thing. Oh, it's just your shoulder, or it's just your knee, or it's just your hip. And next month I'm seeing you for an elbow, and 2 months later I'm seeing you for your wrist. And let's kind of raise our altitude and look and see if we can do some things for your system that would take you more on the wellness side of things, right? So I am not treating chronic disease in my clinic there. But as I explained with the functional kind of integrative approach, it's less about what diseases I'm labeling and more about trying to help people set the conditions in their body, in their system, is kind of the way I explain it, that would make disease less likely. And there are a lot of ways to go about that. So any questions about my background? It's kind of an interesting one. A lot of people don't know how those all came together. But the truth is, from the very beginning with sports medicine being more focused on a proactive, healthy population, it really is fun. It's truly fun, the patients that we see. It's fun to work with athletes. It's fun to work in the lab. I shouldn't say it's fun to see injuries, but what's fun about it is that they usually are recoverable, right? So people are getting better. And that's a nice, energizing paradigm to work within. This other facet of things is the new dimension to my return to sports medicine that's really enriched and enlivened it for me. So it's super energizing. Okay, so what do I do? Well, when you guys learn about taking histories and physicals, you're learning that right now, right? So you have their chief complaint, you have the HPI, what the alleviating factors, right? All of that kind of stuff. So when medical students come and rotate with me, they're looking at our template, and that's what you guys are kind of busy scribbling notes on and kind of memorizing. Pretty soon it will just internalize for you because it leads you to the story where you're going to ultimately help a person. You know about review of systems. You got past medical history, past surgical history, but what is review of systems about? It's kind of the final, what else might we miss? Right? What else did we not ask about? We started really, really focused, and we're going to continually sort of broaden the lens to make sure that there isn't anything else in your history that's going to be necessary for us to make the best, most accurate diagnosis for you, right? And sometimes you find things there and sometimes you don't. Here is where in my sports practice, I've implemented something that I've really, really had a lot of fun with. And I call it the wellness review of systems. That's just my term. I don't even know if it's right. I don't know what the billing coders look at when they look at my template, but it's very, very valuable to me to be systematic in what I'm asking. Okay, the second thing I did when I talked to patients is that I've taken that wellness review of systems and I've actually made a visual. I scribble all the time on that crinkly paper on tables. I'm just kind of a cartoon scribbler. I guess I'm a visual learner, and I think that it helps people engage with something rather than just kind of staring at me as I'm talking the whole time during our visit. So I literally take the elements of my wellness review system and I draw kind of a pyramid structure, which is familiar to them. And I say, are you open to expanding our conversation around more of what your system is engaged with and how all the pieces are working together, the inflammation piece, the healing piece, the digestion piece, the nutrition piece. Are you interested in talking a little bit more about how all of these cooperate inside of your system? Because respectfully, some people are not. Like, yeah, no thanks. I got my knee fixed and that's really all I have time for today. Great, that's fine. I'm not going to be able to want it more than they want it, right? But I will tell you the amount of times that people actually say no thank you. No, I'm just here for this one thing. Almost never. There is, and this is an encouraging thing I think for you guys to keep in mind when you meet with patients. Listen, we all want to know how our bodies work. It's part of what's fascinating once you finally get into medical school and out of all the general sciences in undergrad, because you're learning about human stuff now. Right? This is what you wanted to dig into. So I sometimes will call it kind of the owner's manual for people. So I'll say, there are some owner's manual things to know about. And physicians, not only are we trained to know what's wrong and how to treat what's gone awry, we at the very least have to know what the good owner's manual is like. Right? If you had a car and you only ever attended to it when all the warning lights came on and you had to keep going into the service station, pretty soon they're going to say, you have to put gas in this. You have to change tires. There's some stuff that you can know in terms of basic operations that really are life-changing, right? And so when I engage with people and I ask their permission and I say, do you mind if we take a few minutes and expand what we're looking at here for you? I really think a lot of this is gonna not only help you make you feel better, but it's gonna make my job in making your joint pain a lot better too. So soon we get their permission and they say yes, which they normally do. I scribble out my little pyramid and I start to talk to them about these wellness review systems questions. And I say, okay, I'm deliberately picking this thing at the bottom of the pyramid because there is a little bit of disagreement on this, but for the most part, a lot of people agree that this foundational thing, if we get this up and rolling, is going to have so many positive downstream effects that it is a reasonable place to start our focus. And so for me, that's exercise. That's an easy sell in a sports medicine office with the lab for people who are coming in and are often injured. Yeah, so it's not that I'm dealing with a population who's really movement or exercise averse. So the foundational thing in my pyramid is exercise. That's the first question in my wellness review systems. Tell me a little bit about your activity level during any given week or any given day. And I'm gonna select out for the athlete population for a second because they're kind of unique in their training parameters. But let's just say all comers. And I see demographic that includes ages, I see kids, all the way up to 80s, right? So just general population. Tell me about what your activity is like during the week. And this is where it breaks down into some slightly stereotypic sort of patterns that I've noticed, especially with middle-aged or older. The women primarily are focused a lot on cardio. Maybe they've added yoga or Pilates, a lot of walking programs, right? Does this sound familiar? People, yeah, I walk during the day, or yeah, I do a little stretching or I do a little yoga. And I ask them, what about strength training? Oh no, I'm not a gym person. I don't really do any resistance or strength training. Okay. And then on the other side of that, again, I'm being very clunky about these categories, but I tend to see in more of my, more of the male population, the weight training, resistance training. What do you do for your workout routine? Oh, I go to the gym, I work out 3-4 days a week. How do you divide that up? Oh, I do this, I do back buys, I do chest, whatever it is. How about flexibility training? No, I don't really do flexibility. How about cardio? Oh, I do a little circuit training in between, or go to Orange Theory and do a little HIIT training. But mostly it's centered around resistance, right? Okay, who's right with their program? They're both right with their program, but both of them are missing some key elements. So if I have a population that I'm talking to who spends all day at their desk, comes home, spends all night in front of Netflix, and is too exhausted to even move, they're a really sedentary crew, I just want them to move. And my bar is so low, and I'm so encouraging of any movement because your body is an adaptation machine. And if that's as low as your activity level is, anything up from that is going to trigger a cascade of benefit. Truly, cellular benefit. It changes the way your DNA is transcribed. So I want them to move, in which case they can look at any government agency, any poster, any move it, 10 minutes a day. It can be walking in between classes. It can be parking a little further away and walking to your, and that's what I would call a movement program. And if you're starting from sedentary, or if you're injured and that's all you can do, it's a win. I try to get them to do that 150 minutes a week cumulatively. So the 10 minutes is part of the 150. 30 minutes is part of the 150. But they can chunk it however they would like. That's what I call movement. That's not what I call fitness. So a fitness program, if I really want people to have the benefit of this wellness review systems, this large base at the bottom of the pyramid, I need to know my goal for them for an exercise program, and I'm super specific. So for the people who I want to move the needle a little bit toward this fitness side of things, which is really when all the benefits start happening, I'm crystal clear. And I say this, I want you to have a goal of 150 to 250 minutes a week of zone 2 cardio. You guys ever heard this terminology before? Zone 2 cardio? Do you listen to podcasts that talk about this? Yeah, okay. So these podcasts now are super helpful in terms of raising a lot of people's awareness for some of this terminology. think this is like The Drive, Dr. Peter Attia's podcast. I think Huberman Lab talks about this. A lot of them do. So zone 2 cardio is most helpfully described as a rate of perceived exertion. So it's not tied to a formula because there's too much variation. We've sort of abandoned those 220 minus your heart rate times 70% or whatever it is. There's way too much variation, and we know that because when we take you to our lab and measure your VO2 max and correlate it with your heart rate, it's wildly incongruent. But rate of perceived exertion is pretty good, and that means that when I'm walking, if I'm walking with my friend and I can kind of answer her and carry on a conversation, but I couldn't really sing a song, that's zone 2 cardio. It's sort of boring, honestly. And I tell people that. I said, this is boring. This is the foundational, get your cardio in. This is magic for your cardiovascular and metabolic system. But it is not boot camp, cross-training. You're not tricking yourself into thinking that you're doing all this high intensity for those 150, 250 minutes. This is baseline. This is what you need to have for the maintenance of this VO2 max aerobic stuff. Then you need 3 days a week of strength training. And because your body's an adaptation machine, what you start doing this month, if I see you again in February, you can't keep doing this. You adapted to that 4 months ago. The needle has to keep moving, right? And this is a great place where people work with personal trainers, or there's some good online programs that people use. But strength training, as it's basically defined, you're pushing and pulling against heavy things that needs to progress over time. It needs to feel like a load. There's tons of nuance in how to do it. There's tons of different varieties in terms of programs. I just want people to do it. If you're coming to me and you've already got a pretty robust program and you want to talk about details, all right, you're in a special subset. But for this wellness review systems, I just want them to get 3 days a week of strength training. Some on the top and some on the bottom. HIIT training, high intensity training. You guys heard of this? HIIT training? Heart rate, all max out, kind of your heart rate stuff. Okay, that can be like a 30-minute slice of that 150 to 200 minutes a week. And it's designed specifically to dial up this aerobic efficiency to push that VO2 max a little higher. And we all have a physiologic cap, but you can train it. And it has a lot of health benefits, a lot of cardiovascular benefits, a lot of endurance benefits, a lot of cardiorespiratory is really what I should say. But that's not what you build the cardio around, right? That's a kind of a slice. That's a slice, an important one, but a slice. Because remember, when I see people and they're coming in for injuries, a lot of them have way overshot the mark. I do HIIT training 7 days a week. And I do, right? And so now I'm seeing them for muscle tears or strains or tendinopathies or stuff that we can't easily dial back, and they're devastated, right? They're hard to recover from. So the HIIT training becomes a narrower slice, an important one, but a narrower slice. And then the last part of the exercise that I like them to include is like the stretching, flexibility. So pick a day or two a week and do whatever kind that you like. You can do YouTube stretching, not cold, but as a part of your integrated program, you might include core. This might be Pilates or yoga, but this is your foundation. If you get this right, an astonishing number of things are affected downstream. Mood is affected. Metabolism is affected. Blood sugar is affected. Sleep is affected. Your musculoskeletal health is affected, right? It is an incredible, your risk factor for chronic disease, including cancer, is affected. Your ability to start the fight against obesity and generalized deconditioning is affected, but it has to have a toehold. Make sense? So I'm super granular about what I recommend. The next level up has 2 parts for me. And actually one of them, which is sleep, is really a close second to the exercise prescription. I ask people, how are you sleeping? And most people are not, like, how are you guys sleeping? All right, 7 to 9 hours a night, restful, you wake up, you're not exhausted, pretty even, okay time getting to sleep, okay time waking up, not too much sleep during the day, not needing naps. These are all the generalized questions that I ask people. And you would be the minority if you say you're getting that. Most people are not feeling like they get a restorative 7 to 9 hours of sleep. Even with Oura rings and Whoop and all the things that you can measure for metrics, Sleep hygiene and maintenance is a big deal. And again, there are some really nice granular recommendations that we can give to patients, but if we don't ask them, we don't know. Turns out, sleep deprivation, especially chronically, has a lot of effect on our neuroendocrine system, has a lot of effect on hormones that have a tie to things like satiety. It's really hard, for example, if somebody is sleeping poorly, to really regulate all of their metabolism from a weight issue. So sleep is a big deal. It's not an add-on. Hey, try to get some good sleep. They need a sleep hygiene program maybe, or we take a deeper dive into it if they have more trouble. So sleep, and then it sits side by side with nutrition. That's a huge can of worms. I don't pretend to be a dietitian, registered dietitian. I refer regularly to dietitians. When I was in my integrative practice, everybody had access to a dietitian that they saw regularly in between my appointments. It's a big job. But I do talk to people about a couple of key things, and I say this. Sugar is a way bigger pro-inflammatory problem than you've ever heard about. If you're worried about burning calories, if you're worried about belly weight, if you're worried about what your hormones are doing, if you're worried about inflammation, sugar is really pro-inflammatory. It's tough. And most people have become accustomed, at least in my sort of middle-aged population, to hearing that calories are the enemy, or fat is I gotta go low fat, I gotta go low calories, I gotta burn it off with all the cardio. Turns out insulin resistance and metabolic dysregulation and a lot of visceral fat is a driver of a tremendous amount of chronic disease. And so the solution around insulin resistance and blood sugar regulation and so forth is a huge, huge thing. So I talk to people about cutting out sugar, at the very least soda, right? Those kind of things. The most obvious forms of refined sugar that are just easy to give up. And then food in wrappers. Sugar and food in wrappers. Try for 30 days. Come back, tell me how it goes. Don't eat food in wrappers. Eat real things. Eat the rainbow. Go to the supermarket. Fill up your dinner plate with half colorful, fresh stuff. The other half, some kind of clean protein. Try it for 30 days. Eliminate sugar. Drink ancient drinks. Drink water. Drink tea. Drink coffee. Don't drink sugar. It's shocking how much systemic response there is to those really, really simple suggestions. So again, I'm not trying to revamp their whole eating styles. Sometimes I refer them to dietitians, but those two sit side by side. So now we have exercise, we have an inquiry into sleep, and we have some very basic kind of entry-level questions about nutrition. Sometimes I ask about gut health, depending on how they're doing. And then from there, next step up, I look at stress and hormones. And I actually ask, how's the stress going? And everybody, I want to say, I don't think I'm exaggerating. Nobody's telling me it's fine. It's fine, it's fine. I don't have any stress, I'm dealing with it well. And the truth is, there's a lot of interesting work around this. Stress in and of itself, cortisol squirts that our body puts out are very physiologic. They keep us alert, they keep us in a state of readiness. We need them. But the problem is when it's sustained and we don't have methods to kind of regulate it, right? So I ask about stress and we talk about different techniques. We talk about meditation, or we talk about mindfulness, or we wrap it into the talk about the stretching or flexibility, or simple little interventions. And then at the tip of the pyramid, a lot of people want to ask me about supplements or about lab tests, and which is fine. I'm happy to engage. But what I tell them is, we can't ever get enough traction if we start top down. If we don't have these other things, not fixed, but these other things engaged and rolling forward, we can't stop at the top and out-supplement bad eating, out-supplement no sleep, out-supplement lack of exercise, right? As a physician talking to people, I can't overemphasize how much respectful power you have in influencing a person's behavior and thoughts about things. They really want to know. So in a non-judgmental way, asking permission in terms of, can we chat about this? I really try to open up the floor so that I now have become in their mind a resource to ask about the things that maybe they've been hearing on podcasts or that they've been reading. But I've now asserted my expertise in this arena. Yes, I know about wellness. You should ask me about it. I love wellness. These are the things that I practice. This is how I think it's going to intersect with your diagnosis that you're seeing me for. And I have found that that combination, not wellness as an add-on, or maybe it's left over, or I have my nurse come in and talk about it because this person is, here for out of control blood sugar again. No, this is every bit a part of my patient care and looking at you as a whole person, as asking all the HPI kind of questions, right, for their knee. I have found people are so grateful. And again, there could be selection bias at work. I work in sports medicine. We have a lab. A lot of people are exercising. People come in for injury. But positioning yourself as a person who really knows these things and asks about them gives a very, very strong messages to patients about how important that you think it is. So is it important to you that you're giving them strategies to keep them out of your office, to promote their health and wellness, right? It's a big deal. So there are a lot of little nuances within that when people ask me questions, but I literally have a little dot phrase, and it's my wellness review of systems, and I have these specific recommendations. And when I go over them with patients, I'm very careful not to make it kind of a shaming, guilting thing, but if you don't ask, it doesn't open up the conversation. Yeah? Okay, so that has infused my practice in seeing people who have a lot of difficult things with optimism and energy. And so, that's the message, that it's sustainable to work with people on the wellness front and not have to do just disease management, right? It's improvable. That's it. That's my talk. It's more of like a journey, okay? But what I want to leave you with is this enthusiasm and the energy around it. And so question-wise, I'm happy to address any. I probably went long, but you know where to find me.
So that was fantastic. And you present this in the realm of sports medicine, which I think makes it more obvious.
It does.
Than other areas, and it's probably even more necessary in other areas. I wonder if you could just speak to this practice from the lens, not so much in sports medicine anymore, but from primary care.
Yeah.
And how is it that primary care clinicians or really specialists who are, we call ourselves health systems, but we're really disease response systems.
Right.
And we think we're training health professionals, but we're really training you to be disease responders.
Yeah.
And how in that model can you then kind of open yourself to seeing these opportunities for people?
You know what? I wish I would have understood that this was so important and every bit as valid as taking a medical review of systems when I'm meeting with people. I wish I would have understood that along the lines of a wellness review of systems, it really matters to know this about people. So from a primary care standpoint, no matter what you're seeing people for, I think this is why my wellness review of systems thing has landed with a lot of power for me. It's transferable no matter who you see. And what it says to the person is, you are more to me than your diabetes, or you are more to me than your knee. And so I feel like it travels. The review of systems for wellness for me travels. And it opens up new little conversations. So maybe their primary thing is stress. Maybe everything else they're hitting, but stress is abysmal and they're isolated and they're disconnected. Well, we talk about that. So I think it lends itself very well to primary care. The exercise part, I might have a little bit more weight and authority with, but those prescription recommendations are out there. They're not hard to make. They're not specialized in any way, especially for the people who just want to get moving.
Okay, and any comments or questions from the group? Yeah, please. Welcome, right.
That's fantastic. Thank you, Dr. Lokna.
Yeah.
Very informative. I resonate with you a lot on basically your approach to sports medicine. And I personally worked in orthopedics. I'd like to talk to you afterwards about
Sure.
it. I have a very similar thought about like your approach to medicine versus orthopedics versus like function versus like quality of life, like kind of like trickle down effect you were saying. I guess one question I have for you is, I will say this first. I completely agree with your approach, like to like how you approach a patient and their basically their quality of life and like their health. How much do you think that like institutions or organizations or companies have like can have a negative effect on people's life, even if they do change their lifestyle, their diet, their like their overall lifestyle?
Well, none of us live in a vacuum, yeah? So where you work, who you work with, what your social connections are, they land really heavily. But I'll tell you what, if you can build resilience to stress into your life, and it is a physical endeavor, it's also a mental endeavor. And I think that the role from a physician's standpoint is simply broadening the scope when a person comes in and help them to accomplish those kind of things. How do we build in stress resilience? How do we build in practices and behaviors that are going to have a lot of downstream effect? Because it's too costly not to. We can't let people, either out of ignorance or just not wanting to think about it, spiral toward more and more disease. It's not sustainable for a health system. It's not sustainable fiscally, but I will tell you as a practicing physician who sees sick people, it's not sustainable for practitioners. It's discouraging. It's really hard. So having a different way to approach help with people, even when they're in situations that are where they're kind of stuck, there's usually something in that pyramid we can start addressing. So I'm just looking for a little toe in for forward momentum, I'd say. And yeah, building stress resilience is important.
Questions?
Hi, so thank you for hosting this. It's very cool to see that we're talking about these things here at UC Davis.
Yeah.
So I do want to ask, I previously worked at a clinic also that used VO2 max, kind of like the guiding factor for patients to try to improve.
Yeah.
And like, I'm wondering like how you use that or any other guidances to follow up with patients.
Yeah, great question, because you know what, we love data, and we live in a world where biohacking is really popular. And so if you have access to a lab that does some of that testing, it can be valuable, because to a certain extent, especially if you go from deconditioned to more seasoned, you will see a change. But VO2 max has this genetic and physiologic ceiling for everybody. And so it ceases to be a helpful measure of fitness and improvement at a point. And then you're just using it as a reference range for training parameters, like I was mentioning before, the rate of perceived exertion and so forth. But I will mention one other really important training factor. No, I'm not going to call it a training factor. A piece of data from equipment is body composition. So body composition, to look at lean body mass, how much equipment do you have that you're dealing with that can actually go out and do that resistance training? Becomes particularly germane in middle age, especially for women, perimenopausal and postmenopausal. Sort of the unfair byproduct of aging for everybody is that we're fighting a race against strength loss. We're all going to lose strength. And so to the extent that you want to slow that slide and influence positively your body composition, the resistance training becomes more and more important. So I send a lot of patients for a body comp analysis for lean body mass, because if they're sarcopenic, if they've lost so much lean body mass, I consider that a treatable urgency. Like, that's not just, hey, you're lean, great, you don't have to worry about, all of the obesity-associated comorbidities. No. They're in a really, really bad cycle for a lot of things, not just musculoskeletal. So I do use VO2 max, particularly in people who are making changes in their fitness and they want markers. My elite athletes are not doing those as routinely. Their coaching zones are based on lactate threshold and so forth. But body comp analysis for anybody, non-athletes, really guides my treatment recommendations around strength training. Preserve lean body mass at all costs, which also includes some protein intake. So
I should add that we have an incredible DEXA scanner in the sports
Yeah.
performance lab that actually measures this. If you ever are interested, you just go in there, you lie down, you close your eyes. It's like you're lying on a bed, nothing's happening. And they're able to tell you what your lean mass is and what your visceral fat is. very different than what we do for osteoporosis. Really a remarkable.
It's remarkable.
Yes.
I take advantage of that a lot. I think it costs $75 if people pay out of pocket. It's nothing.
Yeah.
Yeah.
Not too.
Thank you. This is super cool.
Good.
But I have a question in terms of like how well is like sports medicine, integrative wellness, like falls into like the coverage from insurance? Because it sounds like a lot of these things could be cost prohibitive. I'm like,
Good question.
yeah.
All right, so the game of billing and billing codes. I don't pretend to be an expert in that, but I will say that a lot of it has to do with time allotment with patients. When I was working in the integrative practice that I mentioned before with functional medicine, there was a different structure in terms of billing, and so I had bigger swaths of time to do deeper dives in different systems. With my little wellness review of systems, I've kind of distilled it down to the critical things that I try to do on those patients. And so I do need a little extra time to get through all of that if that's the focus of my visit. And then I just bill appropriately for the time code. So it's not covered by insurance. I just have to be strategic about the timing because, again, similar to right now, where people have questions and interests, so do patients. So do my colleagues who, hey, tell me more about. So it's a time thing in terms of getting information across. It's not a lack of support from a coding standpoint. There's a wellness code, there's an injury prevention code, it can be coded and billed. You just have to manage your time well to get through all the material. And sometimes I do a part 1, part 2. That's a strategy of mine too. When things kind of get deep in the weeds or complicated, I'll just tell a person, hey, this was great. Let's consider this our part 1. Come see me for follow-up for a part 2. And that way it's not an abrupt cutting off of the time, and it respectfully gives them another opportunity to talk about more and ask questions. So I kind of do those couple of tricks.
So one of the areas we didn't cover is the area of kind of mindfulness. So I'm going to be mindful and say we're out of time.
I know. That's a hazard for me.
And but we'll have Dr. Lokna back. You can see we have we have an incredible example of wellness practice here, and
I'm pro wellness.
She will be back, and we'll be continuing to do these every month. So stay tuned with us. Bring your friends. You can at least count on a really good meal.
Yeah.
And I think that these talks will be very different than what you're hearing from student wellness. This is about wellness in practice, and really a national initiative that the Secretary of Health and Human Services just said is essentially an issue of national security, because if we don't change the economic debt of healthcare, we're going to sink, and this is clearly where the problem is. So I appreciate you all coming, and this will be an ongoing development or a discussion. I want you all to know you can come to us in the Office of Wellness Education if you have suggestions, or you just want to know what we're doing, or you want to be involved. So with that, I want to thank Dr. Lokna.
My pleasure.
That was
My
outstanding.
pleasure.
Have a good evening.
Thank you. Thanks, everyone.